Hello and welcome to another episode of Conversations with Dr. Westman. Today we're going to be chatting about hypertension or high blood pressure. We also have a bonus for you, and that's Dr. Westman's free top 10 fat loss tips. And we'll put a link in the description for you. How are you doing, Eric?
Doing great. How are you, Glenn?
Fantastic. So hypertension is another name for high blood pressure, and it affects around 45% of the American population. What do you think of that?
It's too many.
What sort of percentage do you see coming to see you in your clinic, coming there with high blood pressure?
Oh, it's so common these days. So I'm an internal medicine specialist by training, and internal medicine doctors are the ones who are typically in charge of treating high blood pressure, complicated high blood pressure. Family medicine GPs do it as well, but an internal medicine doctor is going to be trained in using lots of different types of medicines, and so internal medicine, it's so common now that I can just almost assume that someone's on one medicine for high blood pressure. It's like if they've been seeing medical attention and medical care through the years, eventually they're going to be put on a blood pressure medicine, which is, of course, it's a select group that comes to me, but the blood pressure issues are very, very common, along with now an increasing number of people with diabetes and overweight and obesity. So high blood pressure is a big deal. It's very common. And of course, the reason you don't want it is over time, high blood pressure, immediately very high blood pressure levels can cause stroke and heart attack, but that's uncommon. I mean, usually you have headache and you don't feel well. You end up going to the emergency room. The long-term or chronic complications of high blood pressure are the heart disease, atherosclerosis, generally hardening of the arteries. If the hardening of the arteries affects the heart, that's heart disease. If it affects the brain, that's a stroke and atherosclerosis of the brain, thickening or narrowing of the arteries to the neck. And in the belly, kidney failure can happen with long-term high blood pressure that's not treated. So that's a very common thing that we do in an internal medicine or obesity medicine practice. That's measuring, diagnosing, and treating high blood pressure.
Now, please correct me if I am using the wrong terms here, but I recently learned that there are 4 stages of hypertension. So, and I heard that these stages were normal, pre-hypertension, stage 1, and stage 2. Is this correct? And what are the meanings of these 4 different stages?
Yeah, well, like any sort of progressing illness, you can categorize it into different stages based on whether it's affected any of the other organs. So once you get involvement of the kidneys, mild kidney failure, that sort of thing, you're going to be into these other categories. And the basic thing is you don't want to go down that pathway. You want to find it when it's early, reverse it. And what's very amazing is that you don't, like we're finding with keto medicine or lifestyle change, you don't always have to choose a medication to treat it. So while most doctors are trained to use medications, that's not the only way to treat high blood pressure.
Now, something that's maybe an urban legend or a myth or whatever you want to call it, but it's always, people have thought, or it's common knowledge or common thinking that salt is a diet high in salt is what causes hypertension. Can you tell us what really causes hypertension?
Well, so hypertension, high blood pressure is multifactorial, meaning there are many things that cause it. It would be like saying, here you have a headache and there's only one cause for a headache. When we know that there are a lot of different kinds of headaches, stress headaches, migraines, that sort of thing. So actually, high blood pressure can be caused by many different things. I think in some individuals, salt is a cause of high blood pressure, but not for everyone. So that's where it gets confusing. You get a public health message that salt causes high blood pressure, so everyone should stop eating salt. Well, there'll be people who can eat salt who will be told to not eat salt as a kind of collateral damage, where the public health people don't care if you don't eat salt because they want to help the people who can't eat salt. So that's where the messaging for general recommendations are can be confusing. In most people, salt as a issue for long-term blood pressure is not the major factor, although for some people it is. And then that's been put in people's minds so strongly that when I instruct someone to eat a diet that doesn't limit salt, they'll think they have to anyway. When a lifestyle change that actually addresses high blood pressure in a different way can have more salt. So salt in some people can cause high blood pressure. Carbohydrates in some people can cause high blood pressure. So I add in the dietary factors, that it's carbohydrate, the sugars and starches that can lead to the increase in blood volume and cause high blood pressure. But then the final thing that I really can't fix is the tube or the artery itself. So that if the artery is hardened, atherosclerosis means hardening of the arteries. This can be a cause for high blood pressure because you may have heard the term stiff pipes. So if the pipe is stiff, you might get high blood pressure, and it's difficult to fix that. So a useful way to think about high blood pressure is just think of a garden hose hooked to a faucet, say on the side of your house or at a sink. And every time you turn on the water faucet, that's a heartbeat going through this tube. The hose is your artery. So if you leave your hose out in the wintertime, it gets hard. And then every time you increase the water or blood flow, it's going to increase the pressure. So it's fortunately, our arteries are not like a stiffened hose, like a PVC pipe, even that hard. It's a living thing that can expand. But the older you are, the more possible it is that your arteries have stiffened, and that you might not be able to fix the high blood pressure by changing the lifestyle, cutting the carbs, cutting the salt. But you can see why it's kind of confusing, because it's multifactorial, meaning there are many different factors, multiple factors that contribute to it.
Now, I just heard you say that you can fix the problem. Does that mean that a keto diet or your prescription of 20 grams of total carbs per day can reverse this? It's often been said that hypertension is incurable. Is this true? What is your thoughts on that?
Yeah. So remember, something's incurable if the medical establishment haven't figured out how to do it, right? I mean, so we talk about diabetes being incurable. Well, actually, we can fix that, but we don't use medications. We use lifestyle. Same thing for high blood pressure. And what's very interesting is that the change in the metabolism and the reduction in the amount of blood and fluid that's going around have improvement in blood pressure. And the reason I know that is I have to take away medication from people who are taking medicines for high blood pressure, or their blood pressure will go too low. So, I haven't seen this turned around, and I would love to do a study or help people to turning it around, meaning once you get the pre-high blood pressure, pre-hypertension, it looks borderline's the term actually, borderline high blood pressure, change your diet, lose weight if you have weight to lose. You won't need to go on a medicine for high blood pressure. And actually, it's in the guidelines that are taught, but most doctors overlook the lifestyle change because none of my patients will do that, or there's a loss of confidence that their patients will actually make a lifestyle change. So doctors often will go to a medication first. It's kind of like the branch point for any drug treatment. whether it's a drug treatment for high blood pressure or diabetes or heartburn, or if you can change it by lifestyle, and a keto kind of lifestyle fixes just about all of these things, why not take the time to learn a different way to go about it than to just automatically accept the medication that doctors want to give you? That's a kind of a big theme of lifestyle medicine or keto medicine, that we can actually use a different method of treatment, changing the food basically, instead of choosing a medication.
Before we move on to the next question that I have for you, what sort of time frame do you see? So somebody that comes to your clinic, let's say with pre-hypertension, how long can it take them to turn that around?
The changes in high blood pressure that I see, so that if someone already has high blood pressure and they're on medication, it usually takes days to weeks, maybe even weeks to months, to lower the blood pressure and get people off the medication. It's not as fast or as urgent as, say, taking someone off diabetes medicines, but it's fast enough that I highly recommend home monitoring of blood pressure. There are lots of cuffs that you can get now for use at home. I'm a big fan of measuring blood sugar at home if you have diabetes. Same with blood pressure. You don't live at the office where the blood pressure is typically checked. So you want to be measuring your blood pressure at home and watching the levels, and then you'll know, between visits, even if you can adjust the medicine down or stave off the need for a medication actually. So I love home monitoring for these conditions, because it will many times mean you don't need to take medicines that doctors want to give you.
Eric, my final question for you is for somebody that's watching, that wants to understand if they possibly have high blood pressure. What are the warning signs? What sort of effects would they have to present with high blood pressure?
Yeah, so this is the problem. It's usually silent. So high blood pressure is something you can really only detect in its early phase by having a blood pressure cuff monitoring of it, or a wrist monitor is sufficient. One of the terms that was used in the past is called the silent killer hypertension. Because you won't know. Just about everyone will be asymptomatic, meaning have no headache or no chest pains. Those are really only associated symptoms like that: headache, chest pain, if you have a really high blood pressure level, not the mild changes that most people will have. It's a short, a insidious or a something that doesn't change very fast for most people. So you have to get it checked by a tool, like a blood pressure cuff at the office. I mean, we call these the vital signs in a medical office because they're vital. The first thing you do in a medical office, internal medicine, family medicine, is they check your blood pressure, they check your height, they check your weight, and the blood pressure and the pulse go together because they are so vital to someone's health. If you think about it, it's pretty amazing that someone figured this out. How did the measurement of a blood pressure become important? And it's one of the breakthroughs in internal medicine, really figuring out that it was this long-term elevation in blood pressure causing these different problems. So self-monitoring or self-measurement is really important because there really aren't any symptoms that for most people with high blood pressure.
And just quickly, how often should somebody test? So let's say, for example, they've got their own machine, or they have to go to the doctor or go to the drugstore. If they do testing there, how often should one test?
Yeah, that's going to be dependent on how much it changes, right? So if you're always getting the same number, as you get older, I still believe in a annual or every other year check-in with a family doctor or an internal medicine doctor. I haven't given up on the idea of seeing a doctor, you don't want to always take the medicine your doctor gives, but you want to check in. So early on, it would just be at the doctor's office. You get it checked, or at I would say every year, then every 6 months, and if you see it inching up and borderline, then you're going to want to follow it more frequently. But every year is fine, until you are in that kind of yellow warning zone. Then you want to check it or take action on it actually, and not go down the path of having to have medication treatment for high blood pressure.
Eric, thank you so much for all your words of wisdom today. That is all for today. Don't forget to get Dr. Westman's free top 10 fat loss tips, and the link will be in the description. If you'd like to learn more about Adapt Your Life Academy and our upcoming online courses, you can find us on adaptyourlifeacademy.com. If you enjoyed this video and you would like to see future videos or past videos, you can find us on our YouTube, Facebook, Instagram, and Twitter accounts under the name of Adapt Your Life. On behalf of Eric and myself, this is us signing off of another episode of Conversations with Dr. Westman. Eric, thank you so much. We'll catch up again next week for another episode.
Thank you, Glenn.
Take care.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.